I want people to know that the frustration that I feel when, doctors won't take care of my husband. When he gets home and somebody's denied him relief, I always say, I wonder what they would do if it was their loved one, if it was their kid, their wife, their husband. I just can't imagine that they would say, oh, we're going to give you a vacation from pain relief for a month. It's insane. And, we think of the rules and the regulations trying to protect people, but nobody's protecting my husband from the debilitating pain that he's in. So, he doesn't need protection from himself. He needs protection from the pain. And I've watched him go without and suffer needlessly, and it just makes me angry. So that's how I feel.
Yeah. And you should be angry.
Yeah.
You should.
I mean, nobody ever tells someone with a toothache, no, I'm not going to treat that tooth.
Mm-hmm. Well, yeah, dentists throw everything at you.
Right. Mm-hmm. When I had babies, they were pushing pain drugs on me that I didn't ask for, want, or use.
Mm-hmm.
But when my brother died of cancer, they gave him some relief. What's the difference?
Yeah.
Just because it's ongoing?
Yeah, like Mark said last time, the biggest problem with chronic pain is you don't die.
Exactly.
Yeah.
Yeah, if we could just convince somebody that you were dying immediately, they would take care of you.
Oh, yeah.
But since you're going to live a while,
Then there's a problem.
then there's a problem, and it must
Yeah.
be you.
And why is it that somebody can die in dignity but not live in dignity? Why can't I live in the dignity of being pain-free and somewhat fruitful and productive? Why do I have to suffer the indignity of being labeled a narcotics user, an opiate user, a drug abuser? I've had doctors at St. Pete's tell me I was a dope head and a drug abuser, and really disparaged me, and they didn't even ask me what was wrong with me. They just automatically assumed that when I told them. And I said, I've got a surgical device implanted in me because of the pain. Well, that doesn't mean it's legitimate.
Yeah, because you would go and get surgery just so you could have pain medication.
Right. Right. And a doctor would just put that in just for the...
Just for the heck of it.
It took 4 years to get the intrathecal pump. 4 years.
And currently he has to drive almost 5 hours to Kalispell every 4 months to get it refilled.
They won't refill it here.
There's no one closer who will refill it. And the one in that other city is now telling him he wants to give him a vacation.
From my medication.
He's called it a vacation.
That doesn't
Narcotic.
sound like a very good vacation.
No.
It'd be like booking a ticket for Jamaica and ending up in Guantanamo.
So, yeah, I mean, our situation in Montana is pretty desperate. And there's so many people here, especially with all the veterans who've come home, but also just ordinary people with ordinary illnesses. And we're already rural, we're already spread out. It's hard enough to find a doctor for anything. Why make it harder than it needs to be?